This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us. Cardiacs Part 4.
Congestive heart failure is a result of a loss of contractility resulting in decreased cardiac output. There is a backup of blood into the lungs and increased pressure in the pulmonary system. Because of this, oxygen-carbon dioxide exchange is impeded. As this worsens and pressure continues to increase, the right side of the heart is impacted and the right heart cannot pump blood into the pulmonary system. Venous return is impeded. Pressure continues to back up and eventually other body organs are congested with venous blood. Remember the Starling law and the rubber band? What happens if you keep pulling on the rubber? Well, it can eventually break. If the myocardium is overstretched, it will be ineffective and cardiac output will decrease. Starling's law states that the greater the volume of blood entering the heart during diastole, in diastolic volume, the greater the volume of blood ejected during systolic contraction, or stroke volume, and vice versa. There are many risk factors that may lead to congestive heart failure. It is certainly one of the most common issues following a severe myocardial infarction. Other factors include hypertension, family history, smoking, obesity, alcohol abuse, diabetes, sleep disorders, and cardiotoxic drugs such as chemotherapeutic drugs. Cardiotoxicity is damage to the heart muscle or the conduction system due to the use of these drugs. Congestive heart failure can vary greatly in severity depending on the degree to which the myocardium is affected. Congestive heart failure can also be progressive and worsen over time as myocardial function continues to decrease. Of course, both sides of the heart can exhibit heart failure. Left side heart failure is mostly manifested by pulmonary symptoms, and right-sided heart failure is mostly manifested by systemic systems. Symptoms of left-sided heart failure include anxiety, dyspnea, cough with a frothy sputum, tachycardia, diaphoresis, rales. In severe cases, this is sometimes called the death rattle, wheezing, cyanosis or pallor, and palpitations. Symptoms of the right-sided heart failure include hepatosplenomegaly, with or without pain, pitting edema, jugular venous distension, bounding pulses, and dysrhythmias. And of course, a patient can have both. In general, diagnostics will be indicative of those systems that are affected. An echocardiogram will demonstrate a decrease in cardiac function. Arterial blood gases will demonstrate decreased oxygen and carbon dioxide exchange. An ECG may demonstrate changes associated with a previous MI or signs of chamber enlargement. Hypothyroidism may be a contributing factor. An elevated creatinine suggests renal impairment, and a CBC may suggest infection. Other diagnostic tests may be performed to evaluate other systems that may be impacted. These may include chest x-rays, renal studies, and liver function tests. Congestive heart failure is treated with ACE inhibitors, beta blockers, diuretics, and digoxin. ACE inhibitors relax blood vessels and lower blood pressure. Capitan and Vasotec are two common ACE inhibitors. One side effect of ACE inhibitors is angioedema, which may prompt a visit to the emergency department. We have discussed beta blockers briefly earlier. These slow the heart rate and also reduce blood pressure. Atenolol is a very common prescribed beta blocker. Diuretics simply reduce the amount of circulating fluid. Electrolytes need to be monitored with the use of diuretics. Digoxin is still a mainstay of therapy for congestive heart failure. It improves cardiac contractility and decreasing heart rate. Digoxin levels need to be monitored periodically, and ECG should be evaluated periodically as well. Pericarditis is an inflammation of the pericardium. It can be caused by infection, post-op chest surgery, trauma, cancer, and radiation therapy. It can be very painful, particularly on inspiration. A squishy sound indicative of a pericardial friction rub can be osculated. Endocarditis is typically caused by an infection and can lead to damaged heart valves. Symptoms may be difficult to differentiate from other illnesses and include a slow onset, a low-grade fever, fatigue and malaise, chills and sweats, and murmurs. Treatment is antibiotic therapy and medication for pain relief for both. If invasive procedures need to be performed on these patients, antibiotics are recommended. There may be a need for long-term anticoagulant therapy if valve replacement is performed. ECG should be monitored for AFib, which might indicate thrombus formation. As mentioned before, prophylactic antibiotic therapy is needed before any invasive procedure. The patient should be taught the signs and symptoms of pericarditis and endocarditis so that they can recognize these if they occur. Both of these can range from mild discomfort to extreme pain. Appropriate pain management is essential. We have discussed the cardiac valves in some detail previously. Remind me, which valves are the AV valves? That's right, the mitral valve is on the left and the tricuspid valve is on the right. Okay, so which are the semilunar valves? Yes, the right one is the pulmonary valve. The left one is the aortic valve. Regurgitation is when the valve doesn't close tightly, allowing blood to flow backward. Stenosis is when there is a narrowing of the valve. This abnormal valve doesn't open properly, blocking blood flow. Symptoms for valvular heart disease are related to the valve or valves affected. For example, in mitral stenosis, there may be fatigue, dyspnea, orthopnea, a cough, or pulmonary edema. Atrial fibrillation is common in mitral stenosis. A murmur is often associated with valvular defects. Peripheral vascular disease is caused by the same mechanism as cardiac disease, except that the vessels that are affected are in the periphery. The risk factors are also the same. This means that vessels either become blocked, narrow, or spasmed. The symptoms and treatment for these are listed in the table on your screen. The most common symptom is claudication. Claudication is lower limb muscle pain when walking. It usually goes away after some rest. Similar to angina in the cardiac setting, claudication occurs when there's not enough blood flow to the muscles being used. Surgical treatment may include angioplasty and bypass grafts. Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.